it's become very concerning to see that there are two things out there when it comes to coronavirus information that aren't really getting out there and that people don't want to hear. And in fact, many of them get angry if that information is communicated to them, even though it's entirely factually based. I've witnessed this experience. I felt it personally. Those two pieces of information, very broad pieces of information, but I'll put them out there. One is the good news about how we're progressing with the coronavirus. What is the good news? What do I mean by that? Well, largely the fact that a number of doctors treating coronavirus patients say, hey, good news. We have learned so much more about this virus since the first wave. We have learned how to improve our treatments. We have learned which drugs to give people, how much of them, when to give it to them so that they get better sooner, so that their hospital stays are not as prolonged as they could be. The other is that those doctors also say, we have actually learned who is most hit by all of this. Therefore, presumably telling us who we need to work to protect more, who we need to back up and support, the vulnerable, that we need to have their backs on all of this. And that also means those low-risk populations, well, maybe we can tell them you don't actually need to fear for your lives anymore, like you were. I mean, at the first wave, a lot of people were concerned not just that their elderly loved ones and people who are immunocompromised would get this, but that they were concerned for themselves, that they may die, that their kids would die. We are learning that that is just not the case anymore. And that is good news. And I think a lot of people know that, but many, many people out there have not actually been exposed to that information. That's kind of troubling. And the second part of this, and it's related to the good news, is the statistics, the facts. You know, we live in an era of open data, big data, analytics. These are multi-billion-dollar industries where we get info about absolutely everything, people's consumer habits and their browsing habits to sell ads to them and so forth. You would think that coronavirus data, particularly because this is about saving lives and whether or not society is completely shut down or not, would be equally as nuanced as those other sectors I mentioned, advertising and so forth. But it's kind of not. I mean, there is granular data out there that we are getting more of and learning more about, but there's a resistance for being out there. I've been talking about the comorbidity data, and we've learned that, for instance, in Alberta, 75% of the people who've died of coronavirus have died with 3 or more other underlying medical conditions. Wow, that's quite something. That tells us a number of things. That tells us, well, there are people who are exceptionally vulnerable to this, so maybe we can do more to protect them, to help them out, and so forth. It also tells us that people who are not in that situation are that much less likely to have a serious outcome from it. And, well, maybe we can find ways to cobble the rules such that we're able to liberate those people from the severe restrictions that they and their businesses are operating under. But I learned that there's a big resistance to just getting that information out there more and having that discussion more. Do we still have a number of people in our communities dying of coronavirus? Yes, we absolutely do. But we know more about who they are. We are learning more about why it is that they are susceptible to the virus. And we are learning more about how to treat things. That is all good news. It is stuff that should be discussed more, disseminated more, and here's the key thing, used in both public discussion and public health and political discussions about how to create all these restrictions and measures that we're currently living under. But there's a resistance to all of that. And I find that very alarming, very puzzling, very troubling.